Dylan Reischman suffered the worst leg break in the history of MMA, and it all went down in Campbell McLaren's jaula in Combate Global. Let's take a quick look at the video. Here we see Dylan's opponent lift him up in a beautiful slam, but his left leg got caught behind his body, ensuing in catastrophic failure of bony integrity. Let's take a closer look here. Not for the faint of heart, of course. What we see here is a fracture of the femoral bone. We have two sites where bones can break: closer to the center mass of the body, or proximal or distal, further away from the center mass of the body, what we call a distal fracture. The problem with femoral distal fractures is they might involve the joint surface of the knee, being so close to the knee. What's going to happen after this injury? Of course, paramedics and the ringside physicians will come to the aid of the fighter and stabilize this fracture, like you guys are seeing right there in the picture. We're going to take the patient to the hospital, where he's going to get an x-ray to figure out exactly what type of fracture it is. It could be a comminuted fracture with many small fragments. It could be a transverse fracture with just a clean break through and through, or a helical fracture like you guys are seeing here in the picture. It's most likely what happened because one of those sharp edges almost made it outside of the body and almost poked through the skin, as we're seeing there in the picture. Again, not for the squeamish of heart. What's going to be the workup? Like I said, an x-ray, but in this case, since the bone almost poked out, we have to verify that the vascular structures, the arteries and veins, are not hurt. So we have to do a computer tomography with contrast to make sure that everything is on par and unharmed. After that, when we have a fracture, we manage it in two ways: non-operant, where you don't have to operate and you simply line up the bone and put a cast. In this case, a closer. Not happening, Dylan. We have to go in there and we have to fix that bone and do an internal fixation of the bone. Plates, screws, of course. Orthopedics is going to take care of that. In his case, this is going to be a lengthy recovery, and we're going to see Dylan maybe at the end of 2024 if he does a great rehab process and he can get back to training. Of course, Combate Global fighters have a lot of heart, so this is a young guy. It's going to be tough for him to come back, but I expect him to have a great recovery and come back, and I wish him the best so we can see him again inside La Jaula de Campbell McLaren Combate Global.